KarMMa-4 is trying to apply the utility that we know exists with CAR T cells, but try to bring it more proximal in the patient marathon of treatment. So for example, we know that that Ide-cel works very well in the relapsed refractory, multiply relapsed patients, and that we know from the KarMMa-1 data. But the KarMMa-4 is actually looking to bring this up front. So in this trial, we're going to be looking at patients with high-risk multiple myeloma, which is an unmet need. So these patients will be defined as revised ISS3, and those patients will be eligible to be in KarMMa-4. And the design of the trial is that they get 3 cycles of induction chemotherapy and then go on to apheresis in order to collect the cells that will ultimately be used to make CAR T cells. Thereafter, they get 1 more cycle of induction, and then they go straight to their CAR T cell therapy. Now, there is an opportunity to collect stem cells in there because, of course, many people would want to do that, considering that they may want to do transplant later. So the patients, after their 4 cycles, could collect stem cells. Afterwards, they eventually go on to the CAR T lymphodepleting chemotherapy and then the cell infusion. And after that, maintenance is recommended, but it's based on whatever the provider wants to do. And so the purpose of this trial is A, to understand safety of using these CAR T cells up front, and B, to understand if there is a utility in using this treatment up front for these high-risk patients who uniformly do very poorly after autologous transplant, with the median progression-free survival between 1 and 2 years. And it's just really hard to treat these people because they have such bad disease biology. So we're looking forward to ways that we can apply this technology to different patient populations that have not been yet served by this CAR T technology.